Blood was designed with a purpose. Jehovah created life. He designed blood to support life. In fact, blood is so important that Jehovah says it represents life, and he considers it to be sacred. How does blood work? Arteries and veins are like one-way streets that allow blood to reach all of your cells. Blood in the arteries and veins is like a truck. Blood carries good things, like oxygen and vitamins, to the cells, and carries away bad things, like carbon dioxide and toxins. But what is blood? There are 4 main components that make up blood, and each one plays a special role. Red blood cells carry oxygen and carbon dioxide. White blood cells fight infections. Platelets help to stop bleeding. Plasma is a watery liquid that carries all these cells and lots of other nutrients. Jehovah designed blood very well. But what can go wrong? Jehovah created Adam as a perfect human, but when Adam rebelled, he became imperfect and can only pass on imperfection to his kids. Imperfection means things will not always work the way they are supposed to. When our bodies do not have enough red blood cells, it's called anemia. What can cause anemia? Maybe it is because we do not have enough nutrients like iron. Sometimes this can be corrected by eating better, or by a doctor giving iron for the body to use. Maybe we suffered some trauma and lost a lot of blood. Doctors need to stop the bleeding as soon as possible. Some diseases can prevent blood from being made correctly. For example, sickle cell disease makes deformed cells that cannot carry oxygen well. Some blood cancers can get the body to make too many cells of a certain type, which means that other important cells are not made. What about if you need surgery? Let's see what surgeons can do before, during, and after surgery to conserve blood. Before surgery, doctors can help the body make more blood by giving it all the nutrients it needs. They can also make a careful plan of what they need in case they have problems in the surgery. As the surgery is about to begin, sometimes doctors will take blood out of circulation and replace it with water. So when you bleed, it will be a mixture of blood and water instead of pure blood. As the surgery is ending, then the pure blood can be given back, if necessary. Also, during the surgery, doctors can try to be extra careful. For example, if they notice bleeding, even if it is minor, they can make sure to stop it with medicines, clamps. They can also use a little vacuum to catch any blood, clean it, and put it back in your body. After the surgery is over, the doctors should closely monitor you to make sure that there is no bleeding from the surgery. Sometimes, it might take several days to recover in the hospital. If so, the doctors may ask for blood tests. But imagine what would happen if a doctor takes a lot of blood every few hours for routine blood tests. Pretty soon, the body cannot keep up with the blood being taken out, and you might become anemic. So, if the doctor only does tests that are absolutely necessary and uses a small tube, it will be easier for the body to keep up. Of course, we personally want to show that we respect life and blood. How do we do this? We do it in 3 ways: safety, health, and communication. We show that we value life when we are safe, so we are careful crossing the street. We wear a seatbelt in the car and drive responsibly. We wear personal protective equipment on the job. We also take care of ourselves. We eat right, exercise, get enough rest. If we feel sick, we make sure to go to a doctor who can help us and who respects our wishes. We also make sure that our friends and family understand our wishes. We carry our DPA with us, so that if we are unconscious, doctors will know what we want. Of course, if we are awake, then we should be able to explain what we want and why we want it, or what we don't want and why we don't want it. Jehovah gave us life, and He designed our blood, which supports that life. Of course, because we are imperfect, things sometimes go wrong. Even so, there are many things that doctors can do before, during, and after surgery to help us avoid abusing blood. We all have to do our part though. Do you show by your safety, your health, and your communication that you value life? We hope you will always stay healthy, but if needed, Hospital Information Services is here to help you abstain from blood as our Creator commands.